Call the meeting to order. Make sure your microphones are on, please. No pledge tonight. What? Oh. Okay. Yeah. All right. We will move to board policy revisions. Need a motion, please?
Move to approve revisions to board policies C-131P, G-250P, G-400P, P-205P, E-105P, and F-170P as presented.
Second.
Any questions or comments on any of that?
Nope.
Okay. All in favor?
Aye.
Any opposed? Moving on to C, student handbook, employee handbook, and board manual. We need a motion, please.
I'll make the motion to approve the 2021-2022 student handbook, employee manual, and board manual as amended.
Second.
Any questions or comments on this? All right. All in favor?
Aye.
Any opposed? Moving on to D, the 2021-22 re-entry plan. We need a motion, please.
I figured that would come after. Since
Oh,
we
you're
did
right.
it.
You're right. Sorry.
Okay.
So we had discussion as a task force, talked about mitigation strategies moving forward with the 21-22 school year. We did not have any medical professionals with that group, so I've invited Dr. Latness to speak with us tonight about mitigation strategies and his recommendations. He's a lot smarter than I am, particularly about medical issues. So, Dr. Latness, if you don't mind.
So hopefully you guys can probably hear me.
If you'll step up here to the microphone.
Okay. I'm an absent-minded professor in a mess. So those that don't know me, I'm Kevin Latness. I'm a rheumatologist in town. I get a letter once a year saying I'm the best rheumatologist in Cass County. So prior to that, I'm the only one, so I'm also the worst. I'm here because I've been involved both with the Cass County task force when it was pretty active early on. I also have a PhD in immunology, so I like this stuff as a background. I don't really have an agenda. I'm here to help you guys understand the situation from hopefully an objective standpoint, and I don't have a subjective opinion necessarily. One thing I've learned over the last couple months is I find it much better to be open to listen to people's questions and concerns than to just dogmatically and paternalistically tell people what they should do. And I think that's what everybody wants. With that said, I think it's safe to assume everybody wants their kids back in school to get a good, safe education, to have fun with their peers, to go to graduation, play in football games, basketball games. And that's what I want with my kids. I will start with an ideal situation. And I would say that vaccines are currently, I think, very effective. And if we could vaccinate 100% of people, then from a medical standpoint, that makes the most sense to get this pandemic under control. I'm a realist too, and I know that's not going to happen. In the absence of that, I do think there's pretty good evidence that masking, while it's imperfect, has been effective at limiting the spread, particularly in places like schools. And you're going to find evidence on either side of the spectrum. But in general, most of the sources, medical sources, do feel that masking helps. I heard something on the way over. Somebody asked an expert about what kind of mask is best, and the best kind of mask is whichever one a kid will keep on their face. So those work better than nothing. So I kind of put together general recommendations, and most of you guys went through this last year. I mean, you guys are the experts on how to keep schools safe. So I'm just going to answer questions here in a second. Cleaning, sanitizing schools, I think whatever protocol you had last year is probably the one to follow this year. Is there a certain brand of Lysol that's better than another? I don't think so. Avoid crowded places and limit unmasked situations as much as possible when feasible. Getting kids to not play together on the playground without a mask, that's next to impossible. But some of the older kids are pretty good at it. And then probably important, and again, I don't know what Harrisonville did last year, but I know the county Health Department had some recommendations on when kids get sick, when they test positive, who to quarantine, how long to quarantine. And I'm not an expert on that, so I trust Andrew and the staff over at the Health Department. I do know that nationally and in different states, there's been different rules for those who have been wearing masks. 2 kids wearing masks, it's probably okay. 1 kid's vaccinated, things are much safer. So again, whatever Andrew's supplying to you guys, I assume, do you guys have a working relationship with the Health Department? Okay, good. And then Brittany provided me some questions ahead of time, and I'm just going to go through these. Before I do, I asked Chris Lang at our hospital and the Health Department just to give me some statistics. So if you guys are interested in what's going on this week in the county, I can help you with that. So first of all, from the Health Department, this is a COVID cases based on testing. So there's 2 tests. There's the classic viral test, and then there's a protein test. The state doesn't actually count the protein test as true positives. They call them probables. But our numbers as of July 25th through July 31st, there was 371 positive cases in Cass County. To put that in perspective, that's approximately the number that we had January 24th through January 30th. Okay. I'm happy to share this. I wrote on it, but the other thing is the numbers are going up, and that's why people are concerned. The other thing about this I'll add is you got to realize in Cass County, and I think most of Missouri, about 40% of people have been vaccinated. And even though you can get COVID if you've been vaccinated, that's true. Most of the people aren't that sick or are not sick enough that they even know it. A lot of those are being discovered through close contact. They're asked to go test, and they're found. So there's a bias in these number of positives for sick people, and realize that most of these are unvaccinated. So it's a subset of people in the county. The rate of vaccinations was really high through March and April. Most of that was nursing homes, 65 and older, who were stampeding each other to get to the vaccines. And then things dropped off over the summer. And then you're seeing a little tick up recently because people are paying attention to the current pandemic. Those are the vaccine and COVID case counts for this week. If you guys want to share this, I don't have any problem with that. It's from the county. What's going on in the hospitals is somewhat concerning. And Chris Lang will tell you straight up that one of the things that's most concerning is our community hospitals are full, and they're full with COVID patients to the level that we didn't see actually in December and January. And unfortunately, the Kansas City hospitals that took a lot of our COVID patients aren't taking people. We can't get people transferred. Right now, Chris's census is 8 people in the hospital, of which, let me get the exact right numbers. 3, I think, are in the ICU, which maxes out everybody in the ICU. And one of them is actually on a ventilator. And our hospital is not designed to keep people on a ventilator 24 hours a day. We can do it for short periods of time, then we transfer. But we can't transfer these patients to research or another facility. The resources as far as nursing, we're having to get nurses from agencies to come in. It's expensive. And we have sick employees. There's a whole bunch of reasons for this. So Research Medical Center with Todd Krause is very similar. They have more beds, they have more ICUs, but they're full too and they can't transfer out. So how does this impact Cass County and Harrisonville? Well, when you have a heart attack, when your kid breaks his leg, they go to our ER. Our ER is full of COVID patients. And if you have to be admitted, then and you're critical and you need to transfer for a stroke or a heart attack, it's going to be really hard to do. So it's not just COVID patients that are a problem in the hospital. It's just the healthcare system. So we're kind of maxed out. And that's, as healthcare providers, that's our biggest concern. Why am I telling you this at a school board meeting? Because not that kids get sick, and you're hearing in the news kids are going to hospitals, and that's sensationalized, right? Every one kid gets 10 news reports. But kids do transfer this. I mean, we know this every cold season. Schools are like bioprobes. Teachers are immune because they've seen everything. But the kids go home, and then their parents get sick, their grandparents get sick, and it can exacerbate the problem. So we don't want our kids sick. We want them in school, so we'd like to keep that in place. But our community needs to be safe too. And schools are great, but they're also a risk. So that's the background data. And you guys can stop me for questions anytime. And forgive me, I know you guys are supposed to be quiet, but if anybody has any specific concerns, let me know. So the questions that I got, people want to know the statistics for groups regarding hospitalizations. I went over that in recoveries. We don't report recoveries so much, the state does. In the past 6 weeks, again, the trend, what you need to know is the trend is going up pretty rapidly. The next question was about the efficacy of masks. And there are some myths that masks are, will be the guardian of COVID. Well, they're not. They're a good tool, but they're not perfect. The best mask is, a respirator that you see in World War I, because nothing gets through that. We wear N95s when we're in the ICU and there's high concentration of respiratory droplets. But your standard cloth mask and surgical mask that you can buy at Price Chopper is going to work well. Most of the time, it's protecting people from large droplets from me to you. So if I have a cough or I incidentally sneeze, I don't know I'm sick, that's what it's largely protection. The little micro viruses floating around, it's not going to do, and people know that. But again, the percentage of time, they limit spread. And there's evidence either way, but the majority of health experts across the country support using them. In my opinion, who's being affected most seriously by the Delta virus? What age category? Well, the Delta virus doesn't discriminate against age. What it is discriminating against mostly is vaccination status. And if you look in the hospital, 100% or greater than 95% over the last month or so are unvaccinated people. So again, the vaccines do not prevent you from having the virus come into your body. They're like, what they do is, before you've had an illness, you have 1 or 2 immune cells that are ready to fight it. And they need an army, and it takes weeks to build up enough army to attack it. What the vaccine does is it gets that army ready, and it puts them on the front, so that when you're invaded, you have more than one sniper there at the border. You got all your forces sitting there. And so you're able to keep the concentration of the invader down. But it's not a shield. It's not going to bounce off you. So you're still going to get it. So again, getting back to the question, the Delta virus is affecting everybody. I think the statistics are skewed because the statistics vaccination are higher towards 65 and older. So what we're seeing, we have 40-year-olds in our hospital, 50-year-olds. Children's Mercy has a higher rate of infections now than they've seen in a long time, too. I will say, as a side, RSV, which is a common respiratory illness in the winter, is being reported to be at a very high rate right now. We hardly saw any flu and RSV during the school year when we normally see it. The Children's Mercy, we have no data on this, so I'm not going to quote science. We just have expert opinions locally. They think it's because the kids are getting together and they haven't had masks in April, May, June. I didn't either. It's great. But that's probably it. And we're seeing adults who are coming down with RSV. People with classic fevers, cough, you assume they have COVID. COVID test is normal. Some ERs like ours will check for flu, RSV, and COVID, and we're seeing RSV come out. So be aware of that. Somebody asked, of the cases you're aware of, is vaccination, in your opinion, helping to reduce the effects of COVID? My opinion is, yeah, it's helping reduce the severity. Again, the data that's most compelling is who's in the hospital. And you go across every hospital in Kansas City and Cass County, and the majority, more than 90%, are unvaccinated. So that's the evidence we have. It's real-world data. This is relevant to schools and cleaning. How long can the virus survive on a surface? What are the best ways to sanitize? There's a lot of data on this. If you study this in a vacuum, the virus can live a long time on a surface. Most say up to 3 days. These are RNA viruses, and RNA is a molecule that's very unstable. And so it degrades really quickly. And so even though you can detect that from a swab and what's called a PCR, an amplification. Most of the time, that's not an infectious particle. So it's usually the first few minutes to hours that are a big deal. Meaning if a kid sneezes in the room or coughs, there's respiratory droplets, and his buddy, takes a French fry off his plate, that may be a bad thing. But for the most part, overnight in your school, if a kid had sneezed, it's probably not going to be a big contaminant. And most of the time, your custodial service is going to take care of wiping those things down. I'm not an expert in sanitizing. There's cleaning, sanitizing. You guys are more of an expert in your custodial staff, and I'll defer to them. The mortality rates of school-age kids below 12 is hard. So the CDC has a report. There's been, I want to say, 170 or so deaths in this year. And those age kids, they categorize it 0 through 17 in our country. So 170 deaths in that age is not a high number. But it does happen. It's very obvious that deaths are occurring with people who are brittle, elderly, people with comorbidities. Our young, vibrant kids, they have good immune systems. They're very strong. They can fight it. But the pediatricians are concerned not about necessarily the death rate, but just the transmission and, are these potentially causing any long-term things that we don't know of yet. If we're vaccinated, why are we getting breakthrough cases? Again, if you're exposed to a virus and you got your force up there, it'll still penetrate. And you can still replicate the virus. It's just for a shorter period of time. There are some nuances for viruses where they can deceive our immune system. That's part of what the Delta virus is doing. But for the most part, our immunity, because the mutations are occurring on a large protein, and our immune system has multiple angles of targeting that protein, for the most part, we retain the majority of these defense mechanisms. But again, given enough time, this thing's going to continue to mutate. So those are the questions that were submitted, but I'd be happy to address. I know there's many more. I don't want to consume all your time, and I don't want to tell you guys how to run schools. That's not my position. I just want to answer your questions, and then you guys can formulate what you think is best for the schools.
Any questions?
I have a question. Is that okay or not? This is my first school board meeting.
I think so.
We unfortunately, no. I would say if you've got a question and he's around when the meeting's over.
It's something that everybody, I think, should hear.
Unfortunately, no. There's no audience delegations, so
I'm happy to.
We're taking a vote tonight.
When is the meeting for the audience participation? For you to be able to hear our voices? When is that? Never?
No, we need to move on with what we've got on the agenda here. So do we have any questions for Dr.?
Asking with no audience participation.
Does the board have any questions for Dr. Latness? Okay, thank you. Appreciate it.
I will say that I'm willing to stay here and answer questions as long as you guys want.
Appreciate the information.
Yeah, you bet.
So if you read over the rest of the document, I've highlighted the differences between last year's document and this year's document. I would say that I need to make you aware that regardless of what the opinions of the board are, the CDC is requiring masks to be worn on school buses. That is a requirement.
Next week, they'll probably say that they won't have to.
Ma'am, we can't do this. We need to please let us conduct our meeting. Thank you.
We don't count.
Go ahead, Paul.
During the day, students and staff will be encouraged to wear a face covering when 6 feet social distancing isn't possible. For one-on-one, small group instruction, hallways, etc., and required when directed by a staff member. We do have staff members who have comorbidity. There we go. There's the word I'm looking for. who are immunocompromised. So we will give them that opportunity as required by any disabilities association. So, as Dr. Lightness pointed out, the CDC is allowing the quarantining to not be required for students if both students were wearing a mask properly during that time. So again, the biggest thing is, we're encouraging staff and students to wear the face coverings when they're unvaccinated. Students when they're directed by a staff member who has those issues, and they won't have to be quarantined if both parties are wearing a mask properly. Quarantining is an exception placed there by the CDC only for students, not for staff. So the close contact doesn't fit. I will say that again, just as a reminder, it is not the school district that quarantines; it is the health department that quarantines. So we call because otherwise those families would not be notified within a timely manner. It'd probably be, up to 2, 3, 4 days before the families are contacted that they've had close contact and need to be quarantined. So that's the only changes that we have. So.
Questions?
So to reiterate what you just said, what I think I heard you say was if the only time you'd need to quarantine is if you're not wearing a mask and you're not vaccinated. Is that what I heard or not?
Correct.
Okay.
For more than 15 minutes.
Yeah.
So the 15-minute thing and the 6 feet thing.
Yep, and we're going to do things, our teachers do a good job in the classroom of ensuring that the students are spaced properly. They cluster groups so that the smaller groups are quarantined. I will tell you, we did mask last year. Our quarantines will go up. We'll see a drastic increase in quarantines. I can tell you that.
And so like in the cafeteria, like this year in the cafeteria, will they be going to the cafeteria to eat lunch, or will they be?
So some of them did anyway. So it's determined by building what they can accommodate by building. So HES went to the cafeteria anyways. I mean, they just spaced them apart, and they
They're
have
distancing.
assigned seatings and different things like that. So, basically, what we can control, we can control. What we can't control is bus, because it's considered public transportation. So that has.
Buildings are looking to have them go to the cafeterias and try to keep them spaced as best as possible and looking at each building.
So we'll keep the same clusters so that we can have smaller quarantines when those happen. So, but as far as cleaning, all that, those same principles take place. Frequent hand washing, all those types of things. So.
And this will be revisited probably monthly, if not.
So I would say we need to visit it every month. I think we need to look at the data. I think if we have, one of the things I've included in the plan that's pretty common is to put a specific metric on where we are going to require masks. If 10% of our staff and students are quarantined or isolated, we probably need to look at it then. So that's we have 2,300 students. We have 300 staff members, so that kind of gives you an idea of where our numbers would have to be for those things to take place. So,
And if we go in, masks are optional, we revisit the data, which I like. I like that approach personally. Do we need to, I know you said we can visit that monthly, but let's say our numbers spike and it's on a Wednesday or a Thursday. I know a district to the north of us, they set a meeting every Friday as a placeholder. And if we don't need it, we can cancel it. But if we need it, it's already posted. But if we spiked on a Wednesday and we needed to have a meeting on Thursday, is that possible, or would we have to wait till Friday? Or, what I'm trying to think about is, if we're seeing things go, if we think we're going to see things go up, do we need to go ahead and preset some meetings?
You can do that, or you can just set the number at 10% and say that's the metric, and when you reach that metric, then you go into that
Health
phase.
department looks at 2-week periods
Yeah.
too. There's time frames, and so you don't take they're looking at 2-week periods too.
Mhm.
Good.
Paul, Jason, how would a bad flu year look as far as students out? What would that number?
90%. 90% student population.
So your 10%, here that you talked about would be similar to.
The difference is you're not out for as long, and the staff is really where we get hit. So the only time that it became a big concern for us last year was when we couldn't fill the staff. And so when it gets to that point, well, we won't have a choice. We'll shut down school. I mean,
Well, I guess that was my question, was from a student, from an actual absence, whoever's absent, how many in our worst scenario with flu? Has it been 300, 400 kids out?
no,
students out?
I'd say 10% in a building, but overall to get to 10%, I don't know if I've ever seen that. So.
Okay.
Did we get to 10% last year with COVID?
Between staff and students, no, because we were masking. That's what I'm telling you. We're going to have a higher quarantine number.
That was my
We just need to
question.
be prepared for it. So, I mean, I'm not good, bad, and different.
Right.
No, it is what it is.
Right.
We're dealing with it, and it's a reality of it. If it happens, and we got 500 kids out, or kids and staff, and we have to shut down and do something drastic, it affects parents because you're working. It affects the kids. It affects everybody. But it's also, that is something that's totally out of our control. We're giving folks the option. If somebody wants to send their kid to school with a mask, there's no problem. And that is, now I personally, we've tasked the schools with so many things. My wife, a retired administrator, and we get tasked with feeding kids, clothing, doing all kinds of things. And this is one that, to me, a parent needs to sit down with their kid, and if they want their child to have a mask, they explain why. My niece explained to her 2 kids in elementary school why she wanted a mask because of family health issues on her side of the family. And her kids wore a mask, the others didn't. But the parents explained it and enforced it. I don't want it to be a burden on our teachers that if a
Right.
student or a parent says, I want my child to wear a mask, I don't think it distracts or detracts from the education. And a teacher doesn't need to be the mask police,
Right.
in my opinion. And
We had a lot of that
that's
last-
the
we had a
parents
lot of that
need
last
to
year.
sit down and, to me, a parent needs to sit down and explain why, and they can have a mask, or if we hit a threshold and we impose the mask, then we comply with it. I'm going to be flying on a plane tomorrow. I don't want to have to wear a mask, but I know if I want to fly down to see my daughter, I will have a mask on. And I will wear a mask because I want to see my daughter. So, I'm good with our plan. I think it's logical, it's practical, it gives us that foundation. If it happens, we're going to deal with something, and we got to deal with it. And it may be, we're not going to make everybody happy. Half of our population may want masks, half don't. We're going to make some mad, we're going to make some not, and we're going to have to get through things.
But you're looking at masks optional until we hit a threshold.
Correct.
That's kind of where the
I
discussion's
think it's a
going.
practical approach. It's a realistic approach.
Well, and I guess to tail onto your comment, I would hope that everybody, regardless of what the choice is, respects that it is a choice. It's your choice. It's your child's choice. If I choose my grandkids to wear masks, they should not be affected by your kids that don't wear masks. We do have a bullying policy. I would hate for us to have to go to that point But again, if it's truly the choice, I'm good with that. I think that makes sense. It gets that decision-making into your camp. What else, Paul?
All right. Any other questions or comments for Paul? We need to vote.
How do we need to?
Oh, we need to make a motion.
How do
Sorry,
we
we
need
didn't do that. Make a
I'll
motion.
make a motion. No, we have to make a motion to approve the action plan.
Got to be in
as
the affirmative.
the
Yeah.
or the reentry plan as
Plan
presented.
does it say?
Got to approve the 2021-22
But hang
reentry
on.
plan as presented.
Where in the plan does it say that the masks are optional?
It says
Several
encouraged.
places.
It says
in
encouraged
there.
several
It just
times.
says
It says at the bottom,
Yep.
it says
Okay.
mass strongly encouraged but not required, with question marks, I guess.
Well,
That green part's just,
yeah,
Green part was for
but I
Todd.
know, but it says,
Be
but that was one of your,
encouraged. No,
Well,
that's just thoughts at the
It's right
bottom.
there.
That's
Right.
not-
for
yeah.
discussion, not.
That's just thoughts for
But
discussion.
it says it does say in the plan,
throughout it?
in a
It says
couple places,
several
encouraged.
times.
All right, because
All, you can look back at the highlighted yellow and
okay,
it's on there.
that's fine.
What did you have for a motion, Susan?
To approve the 2021-22 reentry plan as presented. And Doug, is that all right?
That is correct.
Okay.
I'll second it.
Okay. All in favor?
Aye.
Any opposed? Aye. Motion passes. We will move on to E, the substitute report.
Give me just a second.
Okay.
Okay, go ahead. Thank you.
Okay, we need a motion, please.
Move to approve the substitute list for the 2021-22 school year as presented.
Second.
Anything to add to that, Paul? Any questions or comments? All right, all in favor?
Aye.
Any opposed? SRO contract, can we please get a motion for that?
I'll make the motion to approve the school resource officer contract for the 2021-2022 school year as presented.
Second.
This contract represents a 3.3% increase, similar to what we passed to our staff. So just wanted to mention that too. So
Any other questions or comments? All in favor?
Aye.
Any opposed? Scoreboard agreement, can we get a motion?
Move to approve the scoreboard advertising agreement with the Jennings Plumbing as presented.
Second.
Any questions or comments on that?
I just wondered at what point you will know whether it's an annual payment or a monthly payment on that, because both options are given. So how, I guess,
If I don't receive a payment initially, then I will bill them.
then you start billing? Okay.
We haven't any issues with anything, I guess. on that,
well, last
or-
year
We
was
didn't
wouldn't
have
have
it
any.
last year, so
So
I don't know.
this is where we're starting back up again. So.
Okay. Mhm.
All in favor?
Aye.
Any opposed? Admission of non-resident student, can we get a motion?
I move to approve the admission of non-resident student Benjamin Lettington, beginning with the 2021-22 school year, with the stipulation that his mother remain employed with the school district.
Second.
Questions or comments? All in favor?
Aye.
Any opposed? Motion to adjourn, please.
So moved.
So moved. Second.
All in favor?
Aye.
Any opposed? All right, thank you.
Thank you.